What's up, everyone? Welcome back to a brand new video here at Cuspide Insurance. Today we are taking a look at health insurance in Florida for 2025. There's a couple new things here that you almost know about. But before we get started with this video, the marketplace is open. Right now is the time to enroll or renew your health insurance plan. 305-970-8583 in Florida. There are a lot of great plans. It's one of the top states, if not the top states, for new health insurance enrollments every year. So again, 305-970-8583. Call the number on the screen. A lot of our clients are paying $10 a month or less, and it will 100% be one of you as well. So 305-970-8583. Let's get started. So what are you going to learn in this video? The income limits in Florida for the subsidized to qualify for premium tax credit, the list of health insurance companies available, and the average costs of ACA plans in Florida, as well as new changes for 2025. So, all right, new changes to ACA plans for 2025 in Florida. The DACA, Deferred Action for Childhood Arrivals Program, now can get coverage. It's possible now, which wasn't back then, so this is new. As well as for 2025, new lower cost plans for managing chronic/high cost conditions are available. There are tons of new plans. Every year the marketplace plans change slightly, and there are a lot of low cost plans available, especially if you have a pre-existing condition. You can filter it by certain conditions, so it's really cool. Households making less than 150% of the federal poverty level can apply year-round. This is new through all the states. So before, only if you had a special enrollment period, right? Only if you qualified for the special enrollment period can you apply outside of the normal open enrollment. But now, if your household makes 150% of the federal poverty level or less, so for one person that's around $25,000 a year, if you make less than that, if your household makes less than that, you can apply year-round just fine. You don't need to have any lifestyle change before, right? Like getting married, divorced, etc., adding a dependent, changing jobs, whatever. You don't need that. If you're under 150%, you can qualify whenever you want. So ACA protections such as bans on annual and lifetime limits now apply to non-EHB prescription drugs if covered by a plan. So if you had a prescription drug that was non-essential health benefits, that's what EHB stands for, they will not be placing an annual limit on that now. So that's pretty cool. For those who are prescription drugs, like you need them a lot, this is really cool. This is really good. And now you need a Social Security to apply. It is now mandatory. Before, if someone was about to get it, right, you could apply for them so they don't stay without coverage. Then update the application or whatever. But now it is not letting you at all in any platform whatsoever. You need at least a Social Security to apply. So who qualifies for Florida ACA in 2025? Obviously, right, you need a social. We just talked about that. You must have a residency in Florida. You must be either a U.S. citizen or a legal resident of the state. Have something like a green card, worker's permit, employment authorization card, something like that. And you must meet the income level for the subsidized qualification, which is on the screen here. So in order to apply for the subsidy, which is a premium tax credit that makes plans cheaper, because without it, you'd be paying hundreds, if not thousands of dollars a month for your health insurance plan, you need to qualify for what's called a premium tax credit or a subsidy. And this is a chart that does so, right? So if you're under $15,060 a year as a single person, you do not qualify for it because you are under 100% of the federal poverty level. If you are over 400% of the federal poverty level, you do not qualify either because you're simply making too much money. And this is all based all relative to your household size and household income. So if it's a wife, kid, and a husband, that's 3 people. Minimum income needed inside that tax household is $25,820 to apply for a premium tax credit. This is applied monthly. That's why your $500 a month plan is now only $25 a month because you're getting a $475 premium tax credit. So there it is. There's a chart. I've made videos on the income limit, so check it out. I'm not going to go into depth, but that is how you qualify in Florida. So the list of health insurance companies in Florida for 2025, we have a new one with WellPoint being in a few states like Texas, Georgia, Florida. But, you know, your classics, you got Florida Blue, which is Blue Cross Blue Shield. Ambetter, AvMed, Molina, Humana, United Healthcare, Oscar, Cigna, the more popular ones, Aetna, CVS Health, and you got a few other local ones as well. Obviously, I always suggest going with the big ones that are scattered throughout different states, just because they're going to have the largest provider network. So we have contracts with all of these, so any one that you like, we will have. So once again, 305-970-8583. We will always give you the best quote, non-biased, because we make the same from all of them, right? So not like other insurance agents where they only have certain contracts, so they're going to push you to what only they can sell. So keep that in mind. Average cost for 2025 in Florida for ACA plans is $79 a month after a subsidy is applied. The average subsidy given in Florida is $760 a month. The average deductible being $1,428, with the out-of-pocket maximum average being $3,271, relatively low. This is a study taken by Health Sherpa, right? And the average Cuspide client pays around $40 a month, with many of our clients recently going down to as little as $0, $10 a month plan. So once again, call the number on the screen here, 305-970-8583. The marketplace is open. Now is a chance to enroll in a plan, whether it be for your family, dog, friend, neighbor, whatever. Have them call the number on the screen, 305-970-8583. Guaranteed the best price. Super competitive. You will not find it anywhere. Thank you all so much for watching. I will see you all in another video. Take care. Bye-bye.